I'm Dr. Lorenzato. This is an overview about headaches. If I know or we know which particular type of headache you have, you can probably view a shorter video. For many years I worked as an emergency room doctor and I saw numerous people coming in with headaches. The common denominator was dehydration. No matter what the cause of the headache, it seemed to be dehydration was the norm. And people responded very well, sometimes simply to rehydration. So we always address when someone comes in with a headache, are you dehydrated and why? Looking at the underlying cause can be very beneficial. Secondly, most headaches are not serious in the sense that there's no tumor, there's no cancer, there's no underlying horrible disease. Frequently they're tension headaches, sometimes stress headaches, sometimes withdrawal headaches, migraine headaches. Defining the type of headache is usually not too difficult. I've accompanied this video with a short form that I wish you fill out. It really helps us define the underlying causes. Now we'll go through them systematically. Tension headaches usually are either physiological or psycho-emotional tension, and they predominantly start in the back and the neck muscles and extend up to the base of the skull. People tend to have pain there, and then it moves forward in the scalp. Many types of headaches that are not initially tension headaches will result in complex headaches with a tension component. The longer you have a headache, the more likely you're going to have this type of headache. One of my teachers used to say, ask patients, who gave you this headache? Suggesting that the psycho-emotional tensions of interpersonal relationships are a major part. He's probably right. But let's not just say who, but what gave you this headache? Headaches can be associated with high blood pressure. I noticed the day after Thanksgiving and the day after Christmas an inordinate number of people coming in with hypertensive urgency, meaning high blood pressures with headaches, dizziness, fatigue, those types of symptoms. This is dietary. Sodium is a poison. You get too much of it at one time. Hundreds of thousands of years, humans did not do this. Now when we do this, almost routinely, we are putting ourselves at risk. Please stop the sodium overload. When I suspected people were having sodium overload, I would put them in the ICU, just restrict their salt intake and sodium from preservatives and other sources, and within days, usually 72 hours, their blood pressure was back to normal, their headaches were gone, they were fine, until their Cajun family members came in and gave them wonderful food again, in which case their blood pressure just jumped up. Depends how you cook, how you prepare things, what the cuisine is that you've adapted to, whatever it is, cut the sodium. Cut it down to what makes sense from a natural perspective of what we would get without adding it to everything. So, as I said, headaches can be associated with dehydration. Common causes of dehydration including overheating the house, causing very dry environment when we breathe in and out at nighttime. Every time we breathe out, we lose humidity. If we breathe in no humidity, our net effect is dehydration. You can actually look at the skin tour, meaning how wrinkled the tips of your fingers are, how dry your mouth is, how often you urinate. These things are general indications of dehydration. Otherwise, what caused it? Have you been having loose stools and diarrhea? Have you been drinking alcohol, which is a diuretic? Too much coffee, another diuretic? When people have dehydration, they may or may not have nausea. Antiemetics may be beneficial. Clearly, if you rehydrate and give antiemetics, they're far more beneficial. If you rehydrate and give any pain medicine, they're far more beneficial. It is not healthy to give ibuprofen or naproxen in a dehydrated kidney. You want to rehydrate first, then give those anti-inflammatories. Number one thing, rehydrate. Now, oral rehydration therapy in the event of diarrhea as such is a special thing, having sodium and usually some potassium, but mostly sodium initially, and sugar. Person cannot absorb water unless there's some sugar and sodium in the liquid. So just drinking plain water is not a good idea. Migraine headaches are frequently diagnosed by their pattern. They tend to be on one side, predominantly on one side of the face, the head. They can be behind one eye, but they're predominantly also accompanied by a photophobia, a pain on seeing the light, and maybe sound seems to be penetrating and overwhelming. So tendency for people with migraines is to find a very quiet, dark space. The less neurological stimulation, the better off with these headaches, clearly. So quiet, dark place, and rest, rehydration. That was what the mainstay of therapy is. Fortunately, medications like sumatriptan triptan and the other triptans are extremely beneficial in managing migraine headaches normally. So one test for migraine is how well it responds to one of the triptans. Migraines, as I said, commonly on one side can cause a pounding, throbbing pain or a knife-like pain, a tearing pain. A person with a migraine headache frequently will develop the additional stress headache, back of the neck, scalp pain as well, particularly if it extends over 24 hours. It is not uncommon for me to see withdrawal headaches. Caffeine withdrawal is common, decongestant withdrawal, narcotic withdrawal, alcohol withdrawal. All withdrawals seem to be accompanied with headaches to one degree or another. And the question is, for instance, to drink coffee. If in the afternoon you're starting to get a headache, you missed your morning coffee, voila, we have the diagnosis. Withdrawal headaches, you could either say, you're addicted to something, then you better have it so you don't have to suffer the withdrawal, or just recognize what it is, overhydrate, don't go back to an episodic use of what's causing this. Sinus headaches can be mostly in the frontal sinus or in the maxillary sinus, although there are hollow spaces in the mastoid regions behind the ear and the paranasal or the nasal region straight back behind the nose. All these places, in the event that there is blockage and pressure within that space, you get tremendous pain. Most common, people rapid change of altitude when the ostia or the opening of the sinuses are blocked by thick secretions, and they get a horrible headache in a flight, for instance, or going up to the mountains. But it can happen to anyone, anytime. Fluid, rehydration, some medications like guaifenesin, which is in Mucinex and Robitussin, can help thin the mucus. Is there an allergy underlying problem, or has there been an infection, or is there a present sinus infection? All this needs to be addressed. Bacterial toxins that are released, particularly in strep throat, can create a horrible headache. Most viruses result in a headache, muscle pains, joint pain. These headaches, as I said, hydration is the major thing. Tylenol or acetaminophen is extraordinarily beneficial. 500 milligrams times 2. For an adult, 1,000 milligrams only lasts 4 hours. You have to redose and redose and redose. If carbon monoxide is being released from partial combustion in any part of your environment, including cigarettes, you have an increased risk of getting carbon monoxide poisoning and the resulting headache from it. So a headache can be a warning sign. So this is a slide so you can see what oral rehydration solution, how to make one if you want. And basically it's, as I say here, 30 ml or 6 teaspoons of sugar, 2.5 ml or a half teaspoon of glucose in 1 liter of water. Works out good. You can also use vegetable or chicken noodle soup with a little salt and sugar in it. The starch, of course, is very sugary by the time it hits the stomach. Overview. As I've said, the main thing is we're going to start with rehydration. I may get some labs to understand if there's any underlying problem, electrolytes, hormonal, such like this. It may be time for your annual physical exam if you haven't done one, and get an overview of your health. Things like diabetes results in frequent urination and dehydration with headaches. Other causes can result in dehydration. So overview of your, you may need a physiological or nutritional tune-up as part of managing your headaches. Sometimes hypoglycemic episodes in the afternoon will present with headaches. These things are fundamental and not addressed fully in this, but that is why we have visits with you.